Let me start out by telling you what isn't the best treatment for PTSD, and that's medication. And the reason I mention that first is when I see veterans with PTSD who finally admit that's what they think is wrong with them, the first thing they do is hold their hand out and say, okay, I'll take the pill now. Well, medications may help treat certain symptoms, but it's not the treat-all for the condition. It's not, for example, the antibiotic that might be used to treat pneumonia. So if you have pneumonia, you may have a stopped-up nose and a cough and fever and chills and all that. And the treatments that we now have are more like the nose spray for your stopped-up nose, or the cough syrup for your cough, or the aspirin or Tylenol for your fever, or the medication for the muscle aches and so forth. It's not like the antibiotic that we would use to treat the underlying pneumonia. We don't have that medication yet. So medicines may help certain symptoms. For example, we have medicines that may help sleep, may help people sleep through the night. We have another medicine that may help with nightmares. We have certain medications that may help with the depression and the anxiety and the anger and agitation that may go along with PTSD. But medication itself is not the primary treatment. So what is the primary treatment? It's talking therapy, what we call psychotherapy. And there are two types of psychotherapy that have been shown to best help those with PTSD. The first is called CPT, cognitive processing therapy, where we help veterans understand why they do the things that seem so crazy to them. Why do they jump so high when they have an unexpected noise? Why do they get irritated? Why can't they laugh and love like they used to? And cognitive processing can help people understand that and change that behavior. And the second treatment is called prolonged exposure. That's where prolonged exposure, that's where we ask veterans to actually go back in their mind to the traumatic event and re-examine it. And it's kind of scary and anxiety producing to do that. But over the long haul, and it takes 10 to 12 sessions of prolonged exposure, over the long haul, people lose the emotions that are involved with the traumatic event. They don't forget, you never forget, but they learn to cope better emotionally. So those are the two best studied treatments, and then there are other treatments. One is called eye movement desensitization and reprocessing, called EMDR, where the therapist asks the patient to move their eyes back and forth and do some recalling. For some people, acupuncture helps, meditation helps, service dogs may help. There are a lot of things that may be helpful to certain veterans who have PTSD. But the first step is you got to, one, admit there's something wrong with you. Two, whatever treatment is recommended, you have to buy into it, because otherwise you just fight it. You kind of halfway do it instead of really participating in it. Three, you have to trust your therapist, because if you don't trust your therapist, you're probably not going to do what they ask you to do. And fourth, you got to stick with it, because PTSD isn't treated overnight. It takes a while. But the good news is that people can improve. Even those who have seen the worst, most horrible, most guilt-producing events in their life that they assume will never go away, even those people can be helped with appropriate therapy.